What role does Medicaid play in supporting youth mental health?
Well, that's a great question. So Medicaid actually is the single largest payer for youth and teenage mental health services. Most hospitals at best break even. It varies state by state because Medicaid is a federal state partnership. And so some states reimburse at more adequate levels than others. But generally speaking, across the board, this is not well reimbursed. And so here's the problem that we find ourselves in, particularly given the discussion that's going on right now in Washington and the reconciliation bill and what the potential cuts are for Medicaid. When you make any cuts to Medicaid, you're forcing then the hospital, in our case, the Children's Hospital, to go back and decide what services can I still afford to provide and which ones do I have to scale back. That's absolutely the wrong conversation that we should be having. We should be having a conversation with Medicaid about how can you help us build the infrastructure in a much more robust way than we have today, and how can we reimburse these services? How can we make sure that children have access to mental and behavioral health services, not how do we restrict access?